On any given day in the continuing care sector, there's always lots of work to do. Most of this work involves moving things or moving people. And with the dramatic increase in the sector of the population entering continuing care, that is the baby boomers coming of age, this workload is not showing any signs of easing. In fact, it's increasing. It's increasing faster than many have been prepared for, and with this increased workload comes the stark reality of an increased risk of musculoskeletal disorders, or MSDs, and in particular, something that we refer to as repetitive strain injuries, or RSIs. The continuing care sector is one of the highest hit industry sectors, especially for our size. In particular, the workers suffer RSIs of the wrist, elbow, and shoulder.
Really? That's it?
No, of course not. But in this video, what we're going to do is we're going to look at RSIs involving the arms, and of course, some simple steps that you can take to avoid repetitive strain injury of the wrist, elbow, and shoulder. Now, there are three situations that can lead to developing an RSI. The first one is repeated, unaccustomed, or awkward movements. The second is using extreme force with smaller muscle groups and doing this repeatedly, or working with your hands and arms in cold temperatures. But there are some other problems that can make things worse. The biggest one is people trying to work through the pain, thinking they can just walk it off.
I'll just walk it off.
And no, it isn't like the movies. It rarely gets better. In fact, just the opposite is true. It gets worse. So what can you do to reduce your chances of ending up with an RSI? The first thing, it's important to understand how you might be developing, or what you can look for to see that you might be developing an RSI. So you might experience some symptoms that range from pain at the joint, feeling like a burning sensation, and getting worse with use. You may experience numbness and tingling in the extremity, feeling like your hand or the limb itself is going to sleep, or the extremity getting cold or feeling cold with a loss of feeling.
Oh, that sounds bad, yeah.
I have 3 tips for you, and maybe a bonus tip at the end if you stick around to the end of the video on avoiding RSIs. The first thing you want to avoid is repetition wherever possible. Switch hands, switch arms if you can. Alternate tasks where possible. It's like taking a break, so to speak. After all, variety is the spice of life, and varying your tasks can help you to avoid an RSI. Now, the second one should be fairly simple, fairly easy, and that's to avoid the use of extreme force. Use a tool or mechanical aid where one is available, and make sure it's the right tool for the right job. And then incorporate that first principle I just mentioned, which is varying your tasks and taking small breaks. Now, the third one is to dress properly for the work, and that might mean layering up throughout the day and layering down throughout your day. You have to remember, warm muscles and warm joints are more resistant to injury. Injury prevention doesn't take a lot of effort. It just takes a little planning, a little effort to plan the work. It should be noted that repetitive movements and having to apply excessive force are both hazards. Unfortunately, conducting an informal hazard assessment before work begins or before you start your task and implementing those 3 controls I just talked about, which are switching tasks and taking breaks often, using tools or mechanical aids to reduce the strain, and dressing appropriately for the environment. If you take these 3 steps, it will help you to avoid an RSI. Because if we don't look after ourselves, how are we going to look after others? If you want to learn more about that informal hazard assessment I just mentioned, you can have a look up in this corner right here for a video where we go in depth and talk more about that informal hazard assessment.
There's more, isn't there?
Oh, yeah, that 4th tip. Well, this one isn't really that difficult. In fact, it's simple and it's easy. Don't work through the pain. Report injuries and report hazards. In other words, tell your supervisor right away if you're experiencing those symptoms I just talked about. Pain that gets worse with movement. Numbness and tingling in the extremities. Because if you don't, others might be suffering in silence as well. In the meantime, I want you to do me a favor. Work healthy and stay healthy. Okay? Take care.